Hello viewers, welcome back to my channel. This is Rupa Yadav. Today I come with a new video, cervical cancer. So friend, those who are not subscribed my channel, so go to my channel and just subscribe it. And after, if you have any doubt, any comments, just keep it on my comment box and also press the bell icon. Now let's start the topic, cervical cancer. What was the causation of the cervical cancer? What was the effect, and what we take the step about to aware of the cervical cancer? So first we have one questions on my mind, that what is the cervical cancer. So what prevention measure that you can take to reduce our risk of cervical cancer? The cervix, part of the uterus, it's the part where we move when babies, it dilates, and babies can travel through the cervix to the delivered. I describe the cervix as a part of the uterus, the same way that we can think about the state of. Now, today in this video, I mention the United States of data here, not to all India. So, in the state of California, in the is the uterus. It's the top part. Southern California is the bottom part, which is the cervix. They connected, and geographically, they have some similarities, but they have actually very different. And so when you see your option gynae, when they do a pap smear, they have testing for pap precancer cells of the cervix. In this picture, that's the bottom part of this. In the top part of the uterus, top up part of the uterus, and the bottom part is the cervix. In the United States, 40,000 women be diagnosed with the cervical cancer this year, and in my opinion, that's too high. Those are measures that we can take to reduce our risk of cervical cancer, and we are going to talk about it. That next, unfortunately, this is a disease that affect the women both in the US and the internationally on a large scale. Cervical cancer is the most commonly caused by the HPV, that is human papilloma virus. There are different strains of HPV, and 80% of the population will be exposed to HPV during their lifetime. Now, currently, according to data of the America, there are 79 million Americans who have HPV, mean human papilloma virus, and the 40 million people will acquire HPV this year. The HPV vaccine is very important to reduce your risk of the cervical cancer, and we'll talk about that because we know the vast majority of the cervical cancer are caused by the HPV. The cancer is the best prevented when someone receive that vaccine early in life, and if you control and prevention, that's going to be between in ages 11 and 12, early detection can be performed with the help of a pap smear. And so when you see your OBS gyneco for any annual visit, usually they will talk to you about whether you have due for a pap smear, and that's because the pap smear. Because the pap smear is a good screening method for cervical cancer. and precancer of the cervix. There are some rare types of cervical cancer that are not derived by HPV, and that's why I still encourage you aware of the symptoms of the cervical cancer, which can include the irregular bleeding, spotting with intercourse of a sex, and new symptoms like pelvic pain. Now we will discuss about the how can we prevent cervical cancer. There are some basic steps. The most important is to be consider the HPV vaccines. I would encourage everyone who meets criteria to get the HPV vaccines. It's very safe and it has a further. I'm gonna recommend that for my two children when they have a right age of the FDA has just approved the HPV vaccine for people of until age 45, and the Centers for Disease Control Prevention is going to review that recommendation, and if they also agree, ensure a company will now start covering that receive you until age 45 currently. The vaccine between the age 9 and in between the 26, the other recommendation to prevent the cervical cancer would be to reduce smoking if you are smoking, or to stop smoking. Smoking is linked to cervical cancer. Also, to see your gynae for appropriately timed pap smear. The pap smear used to be done every year. We are now spacing that out for the patient based on the certain criteria. Between, I would still encourage you to see your gynae once a year for an annual exam and discuss with her or him to whether you have due to for a pap smear and a HPV test. And then lastly, be aware of symptom. Discuss if you were having bleeding with a sex or a bleeding between periods. Bring that this up with your doctor, whether it's your internal medicine doctor or your obs gyno advocate, for yourself to make sure that there are no symptoms that you are ignoring. We have to UCLA wants you to do will have an entire department of gyno and obstetrics. Now friends, thank you for this video, for watching this video.